Hi everyone, welcome to my cardiovascular disease video series where I'm offering new perspectives for your cardiovascular health. This is video number 4 where our topic today is nutrients depleted by medications, more specifically cardiac medications. This is Dr. Ellen Rencher, and if you've not been following me through this video series or you're not familiar with me, I am a clinical nutritionist in functional medicine, a chiropractor, and I began my career as an exercise physiologist in cardiac rehab. Now, why should you care about nutrient deficiencies? Well, here's an example of how nutrient deficiencies can create havoc with your cardiac conditions. Have you ever had a medication work for a while but then stop working and your symptoms returned? Did your doctor then add another medication or run you through a trial of new medications to get the results you needed? Perhaps it wasn't the medication that stopped working, but rather the nutrient deficiencies that were causing these symptoms to return. You may have a good diet, but medications can attach themselves to a nutrient and pass it out of the body before we can use that nutrient and cause deficiencies. They can alter the pH in your gut so your nutrient can't be properly digested and absorbed. And medications can use up your nutrients because they too need nutrients to work properly. Or they can block the enzymes needed for the production of nutrients, as we saw with CoQ10 and statin drugs. By the time we see nutrient deficiencies on a blood test, our tissues, organs, or bones may have been depleted for much longer. Our body is always seeking homeostasis, a balance, and it will steal nutrients from our tissues, bones, and organs to fulfill the needs elsewhere and maintain a balance in the blood. These deficiencies may show up as symptoms, yet typically we don't equate these symptoms to being a vitamin or nutrient deficiency. Or perhaps we are aware, but not truly concerned until it becomes a condition or a disease. Like having ridges in your fingernails. You may take some minerals for a while, but you're not really concerned until the day you're told you have osteopenia or osteoporosis. And that's very common. In my practice, I often find that my patients aren't motivated to take action on their health until their condition or symptoms have affected their lifestyle, which is why I am glad you decided to join me here today, because this is the video that may change your world as you know it. Watch closely and you just may have an aha moment that will change your entire perspective on cardiovascular disease and how you handle your health. Now, I realize nutrient deficiencies were probably the furthest thing on your mind when your doctor wrote your prescription. And if you're like most of my patients, you may not feel you need any supplements beyond a good diet. But when a medication is taken for an extended period of time, like cardiac medications, you will greatly increase the number and amount of nutrients depleted from your organs, tissues, and bones. Let's take magnesium, for example. It's one of the nutrients often depleted by blood pressure medications. Magnesium will relax your muscles. And if your magnesium level is low, you may experience muscle tension, cramps, spasms, and in your arteries, tense the muscles in the wall of that vessel and cause high blood pressure. Now let's think about this. You're taking a medication that is designed to lower your blood pressure, but because it depletes magnesium, your medication is now causing the very thing you are taking that drug to reduce. Makes you wonder, what other nutrients are being depleted by my medications? And how is it affecting my health? What are the symptoms that alert us that perhaps we have some deficiencies? And that is why I created this video. I want you to be in the know. Your symptoms are warning lights on the dashboard telling you something is just not right. In functional medicine, we use a variety of tests, including a hair analysis, which will get a more accurate reading of your minerals at the tissue level. Using tests like this along with your blood tests, we're able to stay ahead of the game or get you back to health. But at the very least, if you're on a medication, it's a good idea to have regular blood tests to monitor these nutrients and pay attention to your symptoms. Today I will review these common cardiac medications, nutrients they deplete, the symptoms that may arise from these deficiencies, and I'm hoping by the end of this video you may have an aha moment. The medications that we'll be talking about today are aspirin, statin drugs, blood pressure medications, and arrhythmia medications. So let's talk about aspirin. I included this one because many heart patients are told to take an aspirin every day. But even a baby aspirin taken for an extended period of time can deplete your nutrients. Aspirin depletes iron, folate, zinc, and vitamin C. Symptoms from these nutrient deficiencies can be fatigue, muscle weakness, lowered immunity, decreased libido, prostate conditions, elevated homocysteine, which is a cardiovascular disease risk factor, and you may bruise easily, and that is caused from vitamin C deficiency. Vitamin C also plays a role in collagen production, a protein for skin, hair, joints, bones, and blood vessels. Now, I included homocysteine in this symptom list, which is not really a symptom that you would experience, but we talked about this one in my blood test video, and homocysteine rises when you have low folate. And that can be an independent risk factor, meaning that when everything else is normal, your inflammation markers, your cholesterol is all normal, it's still an increased risk factor. So I wanted to point out that while aspirin may be lowering your risk of blood clotting, taking an aspirin every day may cause other risks. And while your doctor may say, well, you just need to take a folate supplement, well, how many people knew this? And are you getting regular blood tests that are testing homocysteine? Otherwise, you may not have noticed that and increase your risk of heart disease. Now, as I continue to list the other medications and nutrients that may be depleted from your medications, I would like you to take a pause before you rush out to buy expensive or inexpensive supplements. There are lots of multivitamins and mineral supplements out there, but not all are created equal, and not all are easily digested or absorbed. Some may act like a drug, causing deficiencies much like the medications we'll be discussing today. Also, it's not a good idea to take an isolated mineral such as magnesium for a long period of time, and you will learn a little bit more about that today. In our next video of this series, video number 5, I will be reviewing types of supplements. Okay, moving on to statin drugs, cholesterol-lowering medication. In our last video on statin medications, I mentioned that statin drugs deplete CoQ10, which is a vital nutrient for your heart. Today, it's common knowledge that you will need to take CoQ10 supplements when taking a statin drug. In the earlier years, we didn't know this, and you were out of luck. And the death rate doubled from 1989 to 1997. So hopefully your doctor has stressed that you must take CoQ10 with your statin medication. In my opinion, CoQ10 should be handed to you along with your prescription. Now, while you can get CoQ10 from foods, it's just not enough when you're taking a drug that interferes with your body's production of CoQ10. Other nutrients depleted with statin drugs are zinc, folate, magnesium, calcium, These lower your immune system, can cause prostate issues, cause muscle cramps, weakness, pain, fatigue. You might have a fast heart rate, shortness of breath, and high blood pressure. Statins also deplete a lot of B vitamins. B1, B2, B6, B12, your fat-soluble vitamins like vitamin D, vitamin E, vitamin K, and iron. A depletion of these vitamins may cause you to have poor digestion, lowering your ability to handle stress, cause shortenings of breath or heart palpitations. You might get sick more often, have skin rashes, blood clotting issues, or lowered energy levels. And it's also important to note that vitamin A may actually increase when you're taking a statin drug. So it's important to have your vitamin A tested in your blood tests. Now let's move on to blood pressure medications. There are all different types, and we're going to start with the ACE inhibitor medications. Examples of ACE inhibitors may include Rencher, lisinopril, quinapril, trandolapril, enalapril, or captopril. Basically, if it ends in april, it may be an ACE inhibitor. These drugs may deplete zinc, magnesium, potassium, and calcium. And I'd like to point out here that minerals like to remain in a certain ratio with each other. As you review the symptom list in front of you, the symptoms of hair loss, slow healing of wounds, all the way down to the frequent infections, prostate problems, loss of sex drive, those are primarily caused by a lack of zinc. Whereas the fatigue, leg cramps, and all the muscle issues, loss of bone loss, high blood pressure, those primarily have to do with the magnesium, potassium, and calcium, which would make sense because calcium is needed to contract a muscle, potassium is needed to tell that muscle to contract, and magnesium is needed to relax that muscle. And remember, your heart is a muscle. Other drugs for blood pressure and arrhythmia medications may include beta blockers or hydrazine. The nutrients depleted here might include CoQ10, magnesium, melatonin, and vitamin B6. And the symptoms are very similar. Again, we're seeing a lot of muscle weakness, the heart failure because of the CoQ10 depletion, pins and needles, which is a nerve interference from this lack of minerals. And as I mentioned, when you have low magnesium, it's going to affect the calcium and potassium, which is at the bottom of the symptom list. You may also have heart arrhythmias and high blood pressure from the low magnesium. And vitamin B6, in addition to chiropractic care, I always make sure that my patients that are suffering with neuropathy or carpal tunnel, that they are taking B6, because vitamin B6 can control that pain and help you recover quicker. Another medication for blood pressure and arrhythmias are calcium channel blockers. Examples of that are amlodipine, nifedipine, felodipine, diltiazem, and verapamil. Nutrients depleted by these medications would include potassium, calcium, vitamin D, and CoQ10. Now, as you look at the symptom list, are you starting to see a pattern? We're seeing fatigue, leg cramps, frequent infections, muscle weakness, heart failure, high blood pressure, rapid or irregular heartbeat. And isn't it interesting that the nutrients depleted by these medications are giving you the very symptoms that cause the need to take these medications in the first place? Nutrient deficiencies causing arrhythmias, high blood pressure, muscle weakness, heart failure, fatigue, muscle pain and cramping. And isn't a heart attack extreme muscle pain and cramping? And here's the aha moment. Could it be that your original symptoms and heart condition were caused by nutrient deficiencies? I'll leave you with that thought and remind you that your health can be restored. Until our next video, the last of this series, here's a thought to ponder. The next time you have a symptom, will you run to get a new prescription, or will you investigate the need for nutrients? While I'm not saying come get a nutrient evaluation while you're experiencing a heart attack, I am saying that medications may be needed for acute care, but it's the nutrient that will nourish your body back to health. I hope I've opened your eyes to the value of these nutrients, and whether you're taking a medication or not, I would encourage you to preventatively investigate your nutrient levels, rather than waiting for symptoms or conditions to arise. Our next video, video number 5, will review how to choose your supplements wisely. I'm also available for consultations if you would like a complete evaluation and guidance to a healthier you. Thank you again for joining me today. This is Dr. Ellen Rencher, and I hope you continue your journey with me to a healthier you.